Prulifloxacin is an antibiotic used to treat a variety of bacterial infections. In this video, let's find. What is prulifloxacin? What is prulifloxacin used for? Contraindication. What are the side effects of taking prulifloxacin? How does prulifloxacin work? How to use prulifloxacin? What is prulifloxacin? Prulifloxacin is a quinolone antibiotic used to treat bacterial infections. Prulifloxacin has not been approved for use in the United States. Prulifloxacin was developed in 1979 and approved in France for human use in 1985. What is prulifloxacin used for? For the treatment of uncomplicated gonococcal urethritis in males and for gram-negative bacterial infections in the gastrointestinal system and the genitourinary tract. Contraindication. Hypersensitivity to quinolones, children less than 12 years, pregnancy, lactation. Side effects. Tendinitis and rupture, usually of the Achilles tendon, are class effects of the fluoroquinolones, most frequently reported with prulifloxacin. The estimated risk of tendon damage during prulifloxacin therapy has been estimated by the French authorities in 2000 to be 1 case per 23,130 treatment days as compared to ciprofloxacin where it has been estimated to be 1 case per 779,600. Pharmacodynamic. Prulifloxacin is a fluoroquinolone antibiotic. Fluoroquinolones such as prulifloxacin possess excellent activity against gram-negative aerobic bacteria such as E. coli and Neisseria gonorrhea as well as gram-positive bacteria including S. pneumoniae and Staphylococcus aureus. They also possess effective activity against Shigella, Salmonella, Campylobacter, gonococcal organisms, and multi-drug-resistant Pseudomonas and Enterobacter. Mechanism of action. The bactericidal action of prulifloxacin results from interference with the activity of the bacterial enzymes DNA gyrase and topoisomerase 4, which are needed for the transcription and replication of bacterial DNA. DNA gyrase appears to be the primary quinolone target for gram-negative bacteria. Topoisomerase 4 appears to be the preferential target in gram-positive organisms. Interference with these two topoisomerases results in strand breakage of the bacterial chromosome, supercoiling, and resealing. As a result, DNA replication and transcription is inhibited. Half-life: 8.6 hours. Dose: take 2 tablets a day, equivalent to 800 mg, divided into 2 times, take 1 tablet in the morning and 1 tablet in the evening. In the first time to quickly achieve an effective blood concentration of the drug, a loading dose of 800 mg, equivalent to 2 prulifloxacin, can be used. Patients with impaired liver function need to adjust dose by increasing the interval between 2 doses in people with reduced blood flow to the liver or liver failure. If there is no jaundice, ascites use twice a day. If jaundice is present, use once a day. If ascites is present, every 36 hours. If have both jaundice and ascites, used every 48 hours. In patients older than 65 years, use a dose of 1 tablet/day, equivalent to 400 mg, divided into 2 times/day, taking half a tablet of prulifloxacin once a day. Safety advice. Prulifloxacin should not be used in pregnant women and lactating women. Nervous effects may occur with the use of prulifloxacin, so patients should be warned not to drive or operate machinery while using prulifloxacin because of possible undesirable effects. That's all the information about prulifloxacin we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.